I've spent 3 decades in cardiology, and I need you to understand something that could save your life or the life of someone you love. Women over 60 are dying from heart attacks at alarming rates, not because their hearts are weaker, but because they're missing the warning signs. And here's the shocking truth. The symptoms women experience are often completely different from what you see in the movies. You know that dramatic scene where a man clutches his chest and collapses? That's not how it happens for most women. In fact, research shows that up to 64% of women who die suddenly from coronary heart disease had no previous symptoms they recognized. They missed the signals their bodies were desperately sending because those signals looked nothing like what they expected. Every single day in emergency rooms across the country, women arrived too late. They ignored the fatigue, dismissed the nausea, and powered through the back pain, thinking it was just part of getting older. By the time they realize something is seriously wrong, precious minutes have been lost, and the damage to their heart muscle is already catastrophic. But here's what gives me hope. Once you know what to look for, you can act. In this comprehensive guide, I'll walk you through the 8 early warning signs of a heart attack in senior women that are too often ignored, overlooked, or misdiagnosed. These aren't vague symptoms. These are specific, scientifically documented signals that your heart is in distress, and recognizing them early can be the difference between life and death. Most women have no idea their symptoms are different, but after today, you will. All medical references and scientific studies I mention are based on current cardiology research and clinical guidelines. Before we begin, I want you to do something for me. Think about the women in your life over 60, your mother, grandmother, sister, or friend. Now ask yourself, would they recognize a heart attack if it didn't feel like chest pain? Share this information with them. It could save their life. Now let's dive into the warning signs, starting with number 8, a symptom so subtle that most women brush it off as stress or aging. Number 8, unusual fatigue that comes out of nowhere. Imagine this. You wake up one morning feeling exhausted, even though you slept through the night. Simple tasks like showering, making breakfast, or walking to the mailbox leave you completely drained. You tell yourself it's just age catching up. Maybe you overdid it yesterday, or perhaps you're fighting off a cold. But this isn't ordinary tiredness. This is profound, unexplained fatigue that doesn't improve with rest. This could be your heart's first cry for help. Studies published in the journal Circulation found that nearly 70% of women who suffered a heart attack reported experiencing unusual fatigue in the days or weeks leading up to the event. This isn't the normal tiredness you feel after a busy day. It's an overwhelming exhaustion that makes even routine activities feel like climbing a mountain. Why does this happen? When your heart's blood supply is compromised, your body has to work much harder to pump blood and oxygen to your vital organs. This extra effort drains your energy reserves, leaving you feeling perpetually exhausted. Many women describe it as feeling like they're walking through mud or carrying extra weight on their shoulders. A 67-year-old retired teacher from Oregon described feeling so tired she could barely stand long enough to cook dinner. She assumed it was depression or maybe anemia. 3 days later, she had a massive heart attack. During her recovery, her cardiologist told her that overwhelming fatigue was her body's way of telling her that her heart was struggling, and had she recognized it, she could have sought help before the crisis hit. Here's what makes this symptom so dangerous. It's easy to dismiss. Women are conditioned to push through fatigue, to chalk it up to stress, aging, menopause, or simply being busy. But when fatigue suddenly appears without explanation, when you can't complete tasks you normally handle with ease, or when rest doesn't restore your energy, you need to pay attention. Ask yourself these questions. Is this fatigue different from what you usually experience? Did it come on suddenly? Does it interfere with your daily life? If the answer is yes, don't wait. Call your doctor and specifically mention that you're concerned about your heart. Extreme fatigue is your body's early warning system. And while it might be easy to ignore, it's often the first domino to fall. The next warning sign is just as subtle but equally critical. Number 7, shortness of breath. Without physical exertion. You're sitting on your couch reading a book or lying in bed trying to fall asleep, and suddenly you can't catch your breath. You haven't been exercising, you haven't been running upstairs, you're just sitting there. And yet you feel like you've just finished a sprint. This is not normal, and it's not just anxiety. Shortness of breath, medically known as dyspnea, is one of the most commonly reported symptoms among women experiencing a heart attack, yet it's frequently misattributed to panic attacks, asthma, or simply being out of shape. According to research from the American Heart Association, nearly 58% of women report shortness of breath as a primary symptom before or during a heart attack, sometimes appearing weeks before the actual event. What's happening inside your body? When blood flow to your heart is restricted, your heart struggles to pump efficiently. This causes fluid to back up into your lungs, making it harder to breathe. Even when you're at rest, your body is starving for oxygen, and your lungs are working overtime to compensate. One 71-year-old grandmother in Wisconsin woke up in the middle of the night gasping for air. She sat upright in bed, convinced she was having a panic attack. She tried breathing exercises, opened a window for fresh air, and eventually fell back asleep. The next morning, she felt fine and dismissed the episode. 2 weeks later, she collapsed in her kitchen from a major heart attack. Her doctors later told her that nighttime breathlessness was a classic warning sign, especially in women. And had she called 911 that night, they could have prevented significant heart damage. Pay attention to these patterns: sudden breathlessness while resting or doing light activities, difficulty breathing when lying flat, you need to prop yourself up with pillows, feeling like you can't get enough air no matter how deeply you breathe, breathlessness accompanied by other symptoms like fatigue, nausea, or chest discomfort. Unlike a panic attack, which usually improves with relaxation techniques, heart-related breathlessness persists and may worsen over time. Unlike asthma, it doesn't respond to inhalers or breathing treatments. If you experience unexplained shortness of breath, especially if it's new, worsening, or happening at rest, seek medical attention immediately. Don't assume it's stress or anxiety. Your heart may be telling you it's not getting the blood flow it needs. Breathlessness is just one piece of the puzzle. The next symptom we'll discuss is so commonly dismissed as a stomach issue that thousands of women delay getting help until it's too late. Number 6, nausea, indigestion, or stomach pain. You feel queasy. Your stomach is churning. You have heartburn that won't go away, or sharp pain in your upper abdomen. Naturally, you think it's something you ate, acid reflux, or maybe a stomach bug. You reach for antacids, drink some ginger ale, and wait for it to pass. But what if it's not your stomach at all? What if it's your heart? This is one of the most dangerous misunderstandings in women's heart health. Gastrointestinal symptoms, nausea, vomiting, indigestion, and abdominal pain, are reported by nearly 40% of women having a heart attack, according to studies published in the Journal of Women's Health. Yet because these symptoms seem so unrelated to the heart, women often delay seeking help for hours, sometimes days. Here's why this happens. The heart and the stomach share nerve pathways. When your heart is in distress, your brain can misinterpret those pain signals as coming from your digestive system. Additionally, during a heart attack, especially in women, the body's stress response can trigger nausea and vomiting as blood flow is diverted away from the stomach to prioritize vital organs. A 69-year-old retired nurse from Pennsylvania felt persistent nausea and upper stomach pain one afternoon. She assumed it was food poisoning from lunch. She took antacids and lay down. Hours later, the pain intensified, spreading to her back and jaw. Only then did she call for help. By the time she reached the hospital, she was in full cardiac arrest. Her medical team later explained that her indigestion was actually her heart struggling, and those early hours of delay cost her significant heart function. Here's how to tell the difference between ordinary stomach issues and heart-related symptoms. Red flags that point to your heart: stomach discomfort that comes with unusual fatigue, shortness of breath, or sweating, upper abdominal pain that feels like pressure, squeezing, or heaviness, nausea that doesn't improve after vomiting or taking medication, indigestion that radiates to your jaw, neck, shoulders, or back, symptoms that feel different from your usual heartburn or digestive problems. If you experience persistent or severe stomach symptoms, especially combined with other warning signs, do not wait. Call emergency services. Tell them you're concerned about your heart, not just your stomach. The difference between treating it as indigestion and recognizing it as a cardiac event could save your life. Stomach symptoms are deceptive, but the next warning sign is even more so because it's something women experience all the time in daily life. Number 5, unexplained sweating or cold sweats. You're sitting quietly, not exercising, not even warm, and suddenly you break out in a cold, clammy sweat. It's not a hot flash from menopause. It's not because the room is too warm. It's a different kind of sweating, drenching, cold, and accompanied by a feeling of dread. This is your body's panic button going off. Cold sweats during a heart attack are caused by your body's stress response. When your heart is struggling, your nervous system releases adrenaline and other stress hormones, triggering sudden profuse sweating. Women often describe this as feeling cold and clammy, like their skin is covered in a thin layer of moisture that won't dry, even in a cool room. Research published in Heart Journal indicates that diaphoresis, excessive sweating, is reported by more than 50% of women experiencing acute coronary events. Yet many women dismiss it as anxiety, menopause, or hormonal changes, especially if they're in their 60s or 70s. One 74-year-old widow in Minnesota woke up in the middle of the night soaked in sweat. Her sheets were damp, her nightgown was clinging to her skin, and she felt an overwhelming sense of unease. She changed clothes, went back to bed, and told herself it was just a bad dream. The next morning, she felt chest tightness and called her daughter, who rushed her to the hospital. She was having a heart attack. The cold sweats from the night before were her first warning. How to recognize dangerous sweating: sudden onset without physical exertion or heat, sweating that feels cold and clammy, not warm, accompanied by nausea, shortness of breath, or chest discomfort, feeling of impending doom or extreme anxiety, sweating that persists even when you try to cool down. Unlike normal perspiration from exercise or heat, heart-related sweating often leaves you feeling cold and shaky. It's your body's emergency signal that something is very wrong internally. If you experience sudden, unexplained cold sweats, especially with other symptoms, do not dismiss it. Call for help immediately. This is not the time to wait and see. Your body is telling you it's in crisis. Sweating is a visible symptom, but the next warning sign is something many women feel but rarely connect to their heart. Number 4, pain or discomfort in the jaw, neck, shoulders, or back. You have a nagging pain in your jaw. Your neck feels stiff. Your shoulders ache. Your upper back is sore. You assume you slept wrong. You have arthritis. Or maybe you strained something doing housework. But what if that pain is coming from your heart? This is one of the most commonly missed signs of a heart attack in women. Unlike men, who typically experience direct chest pain, women often feel referred pain, pain that radiates from the heart to other areas of the upper body, particularly the jaw, neck, shoulders, and back. Studies from the National Institutes of Health show that nearly 30% of women having a heart attack report pain in these areas without any significant chest pain. The reason? Nerve pathways from the heart travel through the upper spine and branch out to these regions, causing your brain to perceive heart pain as coming from your jaw, neck, or back instead. A 65-year-old real estate agent in Colorado went to her dentist complaining of jaw pain. She thought she needed a root canal. The dentist found nothing wrong and suggested she see her doctor. Over the next week, the jaw pain worsened, spreading to her neck and left shoulder. Finally, when she also felt nauseous and short of breath, she went to the ER. Tests revealed she was in the early stages of a heart attack. Her dental pain was actually cardiac pain radiating through her jaw. Warning signs of heart-related pain in these areas: pain that comes and goes, or feels like pressure rather than sharp stabbing. Discomfort that spreads from your chest to your jaw, neck, or shoulders. Aching in your upper back between the shoulder blades. Pain that worsens with exertion and improves with rest, accompanied by other symptoms like fatigue, sweating, or nausea. Many women describe this pain as feeling like a toothache in the jaw, stiffness in the neck, or tension across the shoulders. It's often dull, persistent, and doesn't respond to typical pain relievers or stretching. If you experience unexplained pain in your jaw, neck, shoulders, or upper back, especially if it's new or different from your usual aches and pains, and especially if it comes with other warning signs, get evaluated immediately. Don't wait for it to become unbearable. Your heart doesn't always hurt where you expect it to. Pain in unexpected places can be deceptive, but the next symptom is so common in everyday life that most women never imagine it could be heart-related. Number 3, dizziness or lightheadedness. You stand up and the room spins. You feel unsteady on your feet, like you might faint. You sit down, take a deep breath, and tell yourself you just got up too fast. Maybe you're dehydrated. Maybe your blood sugar is low. But dizziness can also mean your heart isn't pumping enough blood to your brain. When your heart is struggling due to blocked arteries or reduced blood flow, your brain doesn't receive adequate oxygen. This causes dizziness, lightheadedness, or even fainting. Studies show that women are more likely than men to report dizziness as a primary symptom of a heart attack, yet it's frequently attributed to other causes like low blood pressure, medication side effects, or inner ear problems. According to research published in Cardiology, approximately 39% of women report dizziness or fainting in the weeks leading up to a heart attack. This happens because the heart's weakened pumping ability reduces blood flow to the brain, especially when you change positions or exert yourself. A 68-year-old librarian in Vermont felt dizzy while shelving books. She sat down, drank some water, and assumed she was just tired. Over the next few days, the dizziness returned multiple times, sometimes accompanied by nausea. She mentioned it to her daughter, who insisted she see a doctor. An EKG revealed significant blockages in her coronary arteries. She was one dizzy spell away from a major heart attack. Early intervention saved her life. When dizziness is a red flag for your heart, repeated episodes of dizziness or lightheadedness without an obvious cause. Feeling faint or unsteady, accompanied by chest discomfort, shortness of breath, or sweating. Dizziness that occurs during or after physical activity. Feeling like you might pass out, especially if it happens more than once. Dizziness combined with a rapid or irregular heartbeat. It's easy to dismiss dizziness as a minor inconvenience, but when it's persistent, recurring, or accompanied by other symptoms, it demands attention. Your brain is literally telling you it's not getting enough blood, and that's a medical emergency. If you experience unexplained or frequent dizziness, especially with other warning signs, seek medical evaluation immediately. Don't brush it off. Your heart may be struggling, and early detection can prevent a catastrophic event. Dizziness signals that your circulation is compromised, but the next symptom is perhaps the most misunderstood of all. Number 2, chest discomfort that doesn't feel like classic chest pain. Here's where things get confusing. You've been told your whole life that a heart attack means crushing chest pain, but what if your chest just feels uncomfortable? Not painful, not crushing, just off? This is how heart attacks often present in women, and it's why so many are missed. Women are less likely than men to experience the classic elephant sitting on my chest sensation. Instead, they report feelings of fullness, pressure, squeezing, tightness, or discomfort that may be mild or intermittent. Some women describe it as feeling like indigestion in the chest or a tight band across the chest. It may come and go, last for a few minutes, or persist. A landmark study published in Circulation found that 43% of women who had heart attacks reported no chest pain at all, and many of those who did experience chest symptoms described them as discomfort rather than outright pain. This subtle difference causes dangerous delays in seeking treatment. One 72-year-old artist in New York felt a strange tightness in her chest while painting. It wasn't painful, just uncomfortable, like someone was pressing lightly on her breastbone. She ignored it, thinking it was anxiety or maybe tension from sitting hunched over her easel. Hours later, the discomfort spread to her arms and she felt nauseous. She finally called 911. Doctors told her she was in the middle of a heart attack and that her mild discomfort was actually a serious warning sign she had dismissed for too long. Chest discomfort that points to your heart. Pressure, fullness, squeezing, or tightness in the center of your chest. Discomfort that lasts more than a few minutes or goes away and comes back. Feeling like something is pressing on your chest, even if it's not painful. Discomfort that spreads to your arms, jaw, neck, back, or stomach. Chest sensations combined with sweating, nausea, or shortness of breath. The key here is that it feels different. If you've never felt this sensation before, or if it's more intense or persistent than usual, don't ignore it. Too many women delay calling for help because they think, it's not that bad, or it doesn't hurt enough to be a heart attack. Let me be clear. You don't have to be in unbearable pain for it to be a heart attack. Discomfort, pressure, or tightness is enough. If it feels wrong, if it's new, if it's persistent, call 911. Don't wait for it to become severe. By then, irreversible damage may have already occurred. Chest discomfort is a major clue, but the final warning sign is the one that pulls everything together and demands immediate action. Number 1, feeling of impending doom or extreme anxiety. This one sounds strange, almost too vague to be medical, but listen carefully. A sudden, overwhelming sense that something is terribly wrong, even if you can't explain why, is one of the most powerful warning signs of a heart attack in women. You might feel an intense wave of anxiety, fear, or dread that seems to come out of nowhere. You might feel restless, panicked, or like something catastrophic is about to happen. Women describe this as a feeling I was going to die, a sense of impending doom, or the worst anxiety I've ever felt. And here's the critical part. This isn't in your head. It's your body's primal alarm system. When your heart is in crisis, your body releases massive amounts of stress hormones like adrenaline and cortisol. These hormones trigger your fight or flight response, creating intense feelings of fear and anxiety. Research from the Journal of the American College of Cardiology reports that a sense of impending doom is a clinically recognized symptom of acute coronary events, particularly in women. A 70-year-old retired accountant in California woke up at 3 a.m. with an overwhelming feeling that something was horribly wrong. She wasn't in pain, but she felt terrified, restless, and convinced she was in danger. She called her son, who dismissed it as a bad dream, but the feeling persisted, along with mild nausea and fatigue. Finally, she called 911. Paramedics found her in the early stages of a heart attack. Her cardiologist later explained that her sense of doom was her body's way of alerting her to a life-threatening emergency. When anxiety signals a heart emergency, sudden, intense fear or panic that feels different from your usual anxiety, a sense that something is very wrong, even if you can't pinpoint why, feeling restless, agitated, or unable to calm down. Anxiety accompanied by physical symptoms like sweating, nausea, shortness of breath, or chest discomfort, a gut instinct that you need help immediately. This symptom is especially important because women are often told their symptoms are just anxiety or just stress. They're dismissed by doctors, family members, and even themselves. But when that anxiety comes with other warning signs, fatigue, sweating, dizziness, nausea, or chest discomfort, it's not psychological. It's physiological. Your body is screaming for help. Trust your instincts. If you feel like something is seriously wrong, even if you can't articulate it, call 911. Don't let anyone, including yourself, talk you out of it. Women's intuition about their own bodies is powerful, and when your body is telling you you're in danger, you need to listen. What to do if you recognize these warning signs? Now that you know the 8 early warning signs of a heart attack in senior women, here's what you must do if you or someone you love experiences them. 1. Call 911. Immediately. Don't wait. Don't drive yourself. The moment you recognize these symptoms, especially if you have more than one, call emergency services. Do not wait to see if they pass. Do not drive yourself to the hospital. Every minute counts, and paramedics can begin life-saving treatment in the ambulance. 2. Chew an aspirin if not allergic. If you have aspirin and you're not allergic, chew one 325 millimeter tablet. This can help prevent blood clots from growing and may reduce heart damage. 3. Sit down and stay calm. Sit upright, loosen any tight clothing, and focus on slow, deep breathing. Minimize movement to reduce strain on your heart. 4. Unlock your door. If you're alone, unlock your door so paramedics can reach you quickly. Keep your phone nearby so you can stay in contact with emergency services. 5. Don't dismiss your symptoms. Even if you're not sure, even if the symptoms seem mild, seek help. Women's heart attacks are often subtle, and waiting can be fatal. Why women's symptoms are different. You might be wondering, why don't women experience the same dramatic chest pain that men do? The answer lies in biology and anatomy. Women's coronary arteries are often smaller than men's, and women are more likely to have blockages in smaller vessels or experience microvascular disease, where tiny blood vessels in the heart don't function properly. These differences mean that women's symptoms can be more diffuse, subtle, and easily mistaken for other conditions. Additionally, hormonal changes after menopause increase women's risk of heart disease, but symptoms may still present differently than in men. For decades, heart disease research focused primarily on men, which means the classic heart attack symptoms we all learned are actually male symptoms. It's only in recent years that medicine has recognized how differently heart disease manifests in women. This knowledge gap has cost countless women their lives, but awareness is changing, and you now have the information you need to protect yourself and the women you love. Don't ignore what your body is telling you. Heart disease is the #1 killer of women over 60, yet it remains one of the most misunderstood and under-recognized threats to women's health. The 8 warning signs we've discussed: unusual fatigue, shortness of breath, nausea, cold sweats, jaw or back pain, dizziness, chest discomfort, and a sense of doom, are your body's emergency signals. These symptoms are not vague. They are not minor. They are not something to wait out. If you experience any of these signs, especially more than one, call 911 immediately. Don't second guess yourself. Don't worry about being embarrassed if it turns out to be nothing. better to be safe than sorry, has never been more true than with heart attacks in women. Share this information with every woman you know. Print it out. Keep it on your refrigerator. Discuss it with your doctor. The life you save could be your own or that of someone you love. Now I want to hear from you. Have you or someone you know experienced any of these warning signs? What happened? Share your story in the comments below. Your experience could help another woman recognize the signs and seek help in time. If you found this guide helpful, please share it with the women in your life. Heart disease doesn't discriminate, but knowledge is power. Together we can save lives. Stay informed, stay vigilant, and remember, when it comes to your heart, trust your instincts and act fast.